BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 15. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. During a routine antenatal visit, a large ovarian cyst is discovered in a pregnant woman. Which complication is she most at risk of developing? Option A. Malignant change. Option B. Infection. Option C. Torsion. Option D. Calcification. The correct answer is option C. Torsion. Let's go through the options. Malignant change. Malignant change is a long-term risk, not the acute pregnancy danger. Infection. Infection is less likely than torsion. Calcification. Calcification is a chronic, benign change. And the correct answer is torsion. Correct. An enlarging pregnant uterus makes ovarian cyst torsion the main acute risk. So, the right answer is option C. Torsion. Question 2. Which instrument is used to collect a cervical smear for Papinicola testing? Option A. Ayres spatula. Option B. Sims speculum. Option C. Karman cannula. Option D. Ullis forceps. The correct answer is option A. Ayres spatula. Let's go through the options. Sims speculum. Sims speculum is for vaginal wall exposure, not smear collection. Karman cannula. A Karman cannula is for suction evacuation. Ullis forceps. Ullis forceps grasp tissue, not for smears. And the correct answer is Ayres spatula. Correct. Ayres spatula is used to take a cervical pap smear. So, the right answer is option A. Ayres spatula. Question 3. In a young woman with dense breast tissue, which imaging is preferred first for evaluating a breast lump? Option A. Mammography. Option B. Computed tomography scan. Option C. Plain X-ray. Option D. Ultrasound. The correct answer is option D. Ultrasound. Let's go through the options. Mammography. Mammography is poor in dense young breasts. Computed tomography scan. CT is not used for breast lumps. Plain X-ray. Plain X-ray does not evaluate breast lumps. And the correct answer is ultrasound. Correct. Ultrasound is preferred first in young women with dense breasts. So, the right answer is option D. Ultrasound. Question 4. How many days does normal menstrual bleeding usually last? Option A. 1 to 2 days. Option B. 2 to 7 days. Option C. 8 to 10 days. Option D. 10 to 14 days. The correct answer is option B. 2 to 7 days. Let's go through the options. 1 to 2 days. 1 to 2 days is too short for normal menses. 8 to 10 days. 8 to 10 days is prolonged menorrhagia. 10 to 14 days. 10 to 14 days is abnormal. And the correct answer is 2 to 7 days. Correct. Normal menstrual bleeding lasts about 2 to 7 days. So, the right answer is option B. 2 to 7 days. Question 5. A 20-year-old girl complains of gradual weight gain, irregular menstrual cycles and increasing facial hair. What is the most likely diagnosis? Option A. Hypothyroidism. Option B. Polycystic ovary syndrome. Option C. Cushing syndrome. Option D. Prolactinoma. The correct answer is option B. Polycystic ovary syndrome. Let's go through the options. Hypothyroidism. Hypothyroidism causes weight gain but not hirsutism with irregular cycles. Cushing syndrome. Cushing has other features, striae, buffalo hump. Prolactinoma. Prolactinoma causes galactorrhea amenorrhea, not hirsutism. And the correct answer is polycystic ovary syndrome. Correct weight gain, oligomenorrhea, and hirsutism in a young woman indicate PCOS. So, the right answer is option B. Polycystic ovary syndrome. Question 6. A woman who previously delivered a baby with Down syndrome is now 12 weeks pregnant. What should be done next? Option A. Wait for second trimester. Option B. No screening needed. Option C. Screen in the first trimester. Option D. Repeat scan at term. The correct answer is option C. Screen in the first trimester. Let's go through the options. Wait for second trimester. Waiting delays a needed early screen. No screening needed. Screening is needed given her history. Repeat scan at term. A term scan is far too late for screening. And the correct answer is screen in the first trimester. Correct with a prior Down baby, offer first trimester screening now, 11 to 13 weeks. So, the right answer is option C. Screen in the first trimester. Question 7. Shortly after marriage, a young woman develops painful and burning urination. This condition is commonly called Option A. Honeymoon cystitis. Option B. Pyelonephritis. Option C. Urethral stricture. Option D. Interstitial cystitis. The correct answer is option A. Honeymoon cystitis. Let's go through the options. Pyelonephritis. Pyelonephritis gives fever and loin pain. Urethral stricture. A urethral stricture is not the typical cause here. Interstitial cystitis. Interstitial cystitis is chronic, not postcoital. And the correct answer is honeymoon cystitis. Correct postcoital dysuria soon after marriage is honeymoon cystitis. So, the right answer is option A. Honeymoon cystitis. Question 8. An 18-year-old girl stopped menstruating after undergoing dilation and curettage for a miscarriage. Which syndrome has she developed? Option A. Sheehan syndrome. Option B. Polycystic ovary syndrome. Option C. Premature ovarian failure. Option D. Usherman syndrome. The correct answer is option D. Usherman syndrome. Let's go through the options. Sheehan syndrome. Sheehan follows postpartum hemorrhage, not D&C. Polycystic ovary syndrome. PCOS is not caused by D&C. Premature ovarian failure. Premature ovarian failure is not caused by curettage. And the correct answer is Usherman syndrome. Correct amenorrhea after D&C from intrauterine adhesions is Usherman syndrome. So, the right answer is option D. Usherman syndrome. Question 9. Gonadotropin-releasing hormone from the hypothalamus stimulates the pituitary gland to release which two hormones? Option A. Thyroid-stimulating hormone and prolactin. Option B. Follicle-stimulating hormone and luteinizing hormone. Option C. Adrenocorticotropic hormone and growth hormone. Option D, oxytocin and antidiuretic hormone. The correct answer is option B, follicle-stimulating hormone and luteinizing hormone. Let's go through the options. Thyroid-stimulating hormone and prolactin. GnRH does not release TSH prolactin. Adrenocorticotropic hormone and growth hormone. ACT-GH are not GnRH-driven. Oxytocin and antidiuretic hormone. Oxytocin Adhar posterior pituitary hormones. And the correct answer is follicle-stimulating hormone and luteinizing hormone. Correct, GnRH stimulates the pituitary to release FSH and LH. So, the right answer is option B. Follicle-stimulating hormone and luteinizing hormone. Question 10. A 40-year-old mother of 5 has heavy painful periods, and on examination her uterus feels soft, boggy and uniformly enlarged. She is most likely suffering from Option A, fibroid uterus. Option B, endometrial polyp. Option C, adenomyosis. Option D, cervical carcinoma. The correct answer is option C, adenomyosis. Let's go through the options. Fibroid uterus. A fibroid uterus feels firm and nodular, not boggy. Endometrial polyp. A polyp is focal, not a uniformly enlarged uterus. Cervical carcinoma. Cervical carcinoma does not enlarge the uterus this way. And the correct answer is adenomyosis. Correct, a soft, boggy, uniformly enlarged uterus with painful heavy periods is adenomyosis. So, the right answer is option C. Adenomyosis. Question 11. Regarding dysgerminoma of the ovary, all of the following statements are true except Option A, lymphatic spread is late. Option B, it is radiosensitive. Option C, it is common in young females. Option D, it responds well to chemotherapy. The correct answer is option A, lymphatic spread is late. Let's go through the options. It is radiosensitive. It is radiosensitive, true. It is common in young females. It is common in young females, true. It responds well to chemotherapy. It responds well to chemotherapy, true. And the correct answer is lymphatic spread is late. Correct, the statement is false. Dysgerminoma spreads via lymphatics early, not late. So, the right answer is option A. Lymphatic spread is late. Question 12. How do ovarian germ cell tumors generally respond to chemotherapy? Option A, poor response. Option B, no response. Option C, paradoxical growth. Option D, good response. The correct answer is option D, good response. Let's go through the options. Poor response. Germ cell tumors are not poorly responsive. No response. They do respond. Paradoxical growth. They do not grow paradoxically. And the correct answer is good response. Correct, ovarian germ cell tumors respond well to chemotherapy. So, the right answer is option D. Good response. Question 13. A woman arrives in the emergency room with blood pressure of 80/60, a pulse of 125 per minute, and an acute abdomen. What should be done first? Option A, immediate laparotomy. Option B, 4 fluids then laparotomy. Option C, oral analgesics. Option D. Discharge on antibiotics. The correct answer is option B. 4 fluids then laparotomy. Let's go through the options. Immediate laparotomy. Immediate laparotomy without resuscitation risks arrest. Oral analgesics. Oral analgesics are inadequate. Discharge on antibiotics. Discharge is dangerous in a shocked patient. And the correct answer is 4 fluids then laparotomy. Correct. Resuscitate with 4 fluids first, then proceed to laparotomy for the acute abdomen with shock. So, the right answer is option B. 4 fluids then laparotomy. Question 14. Near menopause, a woman is found to have a solid ovarian tumor together with hyperplasia of the endometrium on biopsy. Which estrogen-producing tumor is responsible? Option A. Dysgerminoma. Option B. Mucinous cystadenoma. Option C. Fibrodecoma. Option D. Krickenberg tumor. The correct answer is option C. Fibrodecoma. Let's go through the options. Dysgerminoma. Dysgerminoma is not estrogen-producing. Mucinous cystadenoma. Mucinous cystadenoma is not hormonally active. Krickenberg tumor. Krickenberg tumor is metastatic, not estrogenic. And the correct answer is fibrodecoma. Correct. A fibrodecoma, thecoma, produces estrogen, causing endometrial hyperplasia. So, the right answer is option C. Fibrodecoma. Question 15. A 47-year-old woman feels heaviness and pressure in her pelvis without pain, and examination reveals a mass beside the uterus. What is the most likely origin of this mass? Option A. Ovarian mass. Option B. Full bladder. Option C. Pelvic kidney. Option D. Rectal mass. The correct answer is option A. Ovarian mass. Let's go through the options. Full bladder. A full bladder is midline and transient. Pelvic kidney. A pelvic kidney is uncommon. Rectal mass. A rectal mass is posterior, not adnexal. And the correct answer is ovarian mass. Correct. A mass beside the uterus causing pelvic heaviness is most likely ovarian in origin. So, the right answer is option A. Ovarian mass. Question 16. Fine needle aspiration of a large ovarian cyst shows malignant epithelial cells containing some MOMA bodies. What is the diagnosis? Option A. Mucinous cystadenoma. Option B. Mature teratoma. Option C. Ovarian fibroma. Option D. Serous cystadenocarcinoma. The correct answer is option D. Serous cystadenocarcinoma. Let's go through the options. Mucinous cystadenoma. Mucinous cystadenoma is benign without some MOMA bodies. Mature teratoma. A teratoma does not show some MOMA bodies. Ovarian fibroma. A fibroma is a benign stromal tumor. And the correct answer is serous cystadenocarcinoma. Correct. Malignant epithelial cells with some MOMA bodies indicate serous cystadenocarcinoma. So, the right answer is option D. Serous cystadenocarcinoma. Question 17. When carcinoma of the cervix extends to involve the upper two-thirds of the vagina, which stage is assigned? Option A. I. Option B. 2. Option C. 3. Option D. 4. The correct answer is option B. 2. Let's go through the options. I. Stage I is confined to the cervix. 3. Stage 3 reaches the lower vagina or pelvic wall. 4. Stage 4 involves bladder, rectum or distant spread. And the correct answer is 2. Correct spread to the upper two-thirds of the vagina, not pelvic wall, is stage 2. So, the right answer is option B. 2. Question 18. Clear cell adenocarcinoma of the vagina in young girls is caused by which drug taken by their mothers during pregnancy? Option A. Warfarin. Option B. Diethylstilbestrol. Option C. Thalidomide. Option D. Phenytoin. The correct answer is option B. Diethylstilbestrol. Let's go through the options. Warfarin. Warfarin is not linked to vaginal clear cell cancer. Thalidomide. Thalidomide causes limb defects. Phenytoin. Phenytoin causes fetal hydantoin syndrome, not this. And the correct answer is diethylstilbestrol. Correct maternal diethylstilbestrol, DES, causes clear cell vaginal adenocarcinoma in daughters. So, the right answer is option B. Diethylstilbestrol. Question 19. A 4-year-old girl develops breast enlargement and vaginal bleeding. Which ovarian tumor produces this picture? Option A. Dysgerminoma. Option B. Mature teratoma. Option C. Granulosa cell tumor. Option D. Brain tumor. The correct answer is option C. Granulosa cell tumor. Let's go through the options. Dysgerminoma. Dysgerminoma is not estrogenic. Mature teratoma. A teratoma does not cause precocious puberty. Brain tumor. A brain tumor is usually inactive. And the correct answer is granulosa cell tumor. Correct, a granulosa cell tumor secretes estrogen, causing precocious puberty, breast development, bleeding. So, the right answer is option C. Granulosa cell tumor. Question 20. After hysterectomy for fibroids, a woman repeatedly fails to pass urine. Damage to which nerve structure explains this problem? Option A. Hypogastric plexus. Option B. Pudendal nerve. Option C. Femoral nerve. Option D. Obturator nerve. The correct answer is option A. Hypogastric plexus. Let's go through the options. Pudendal nerve. The pudendal nerve supplies the perineum, not detrusor autonomic control. Femoral nerve. The femoral nerve affects the leg. Obturator nerve. The obturator nerve affects thigh adduction. And the correct answer is hypogastric plexus. Correct, injury to the pelvic autonomic, hypogastric, plexus during hysterectomy causes bladder dysfunction, urinary retention. So, the right answer is option A. Hypogastric plexus. Question 21. The first stage of labor begins with true labor pains and ends at which point? Option A. Delivery of the baby. Option B. Delivery of placenta. Option C. Rupture of membranes. Option D. Full cervical dilation. The correct answer is option D. Full cervical dilation. Let's go through the options. Delivery of the baby. Delivery of the baby ends the second stage. Delivery of placenta. Placental delivery ends the third stage. Rupture of membranes. Membrane rupture is not the defined end of the first stage. And the correct answer is full cervical dilation. Correct, the first stage ends at full 10 centimeters cervical dilatation. So, the right answer is option D. Full cervical dilation. Question 22. At how many weeks of gestation can transvaginal ultrasound first detect a pregnancy? Option A, 3 weeks. Option B, 5 weeks. Option C, 8 weeks. Option D, 10 weeks. The correct answer is option B, 5 weeks. Let's go through the options. 3 weeks. 3 weeks is too early to see a pregnancy. 8 weeks. 8 weeks is later than the earliest detection. 10 weeks. 10 weeks is well after first detection. And the correct answer is 5 weeks. Correct, transvaginal ultrasound detects an intrauterine sac at about 5 weeks. So, the right answer is option B. 5 weeks. Question 23. During examination, a woman catches her breath when the examiner presses under the right costal margin as she breathes in. This positive Murphy sign indicates option A, acute appendicitis. Option B, acute cholecystitis. Option C, acute pancreatitis. Option D, perforated ulcer. The correct answer is option B, acute cholecystitis. Let's go through the options. Acute appendicitis. Appendicitis gives right iliac fossa pain, not Murphy's sign. Acute pancreatitis. Pancreatitis gives epigastric pain to the back. Perforated ulcer. A perforated ulcer gives generalized peritonitis. And the correct answer is acute cholecystitis. Correct, a positive Murphy sign, arrest of inspiration on rook palpation indicates acute cholecystitis. So, the right answer is option B. Acute cholecystitis. Question 24. The combination of fever with rigors, jaundice and pain in the right upper abdomen is called Charcot triad and indicates option A, acute cholecystitis. Option B, acute hepatitis. Option C, ascending cholangitis. Option D, liver abscess. The correct answer is option C, ascending cholangitis. Let's go through the options. Acute cholecystitis. Cholecystitis lacks the full triad. Acute hepatitis. Hepatitis does not give rigors with biliary pain. Liver abscess. A liver abscess is a differential but the triad defines cholangitis. And the correct answer is ascending cholangitis. Correct, fever with rigors, jaundice and rook pain, Charcot triad indicates ascending cholangitis. So, the right answer is option C. Ascending cholangitis. Question 25. What is the most common cause of acute pancreatitis? Option A, gallstones. Option B, alcohol. Option C, trauma. Option D, hypercalcemia. The correct answer is option A, gallstones. Let's go through the options. Alcohol. Alcohol is the second commonest cause. Trauma. Trauma is uncommon. Hypercalcemia. Hypercalcemia is a rare cause. And the correct answer is gallstones. Correct, gallstones are the commonest cause of acute pancreatitis. So, the right answer is option A. Gallstones. Question 26. In acute appendicitis, pain that starts around the umbilicus later shifts to which region? Option A, left iliac fossa. Option B. Epigastrium. Option C. Right hypochondrium. Option D. Right iliac fossa. The correct answer is option D. Right iliac fossa. Let's go through the options. Left iliac fossa. The left iliac fossa is not the appendicitis site. Epigastrium. The epigastrium is not where it localizes. Right hypochondrium. The right hypochondrium is not the classic shift. And the correct answer is right iliac fossa. Correct, periumbilical pain shifts to the right iliac fossa in appendicitis. So, the right answer is option D. Right iliac fossa. Question 27. A thyroglossal cyst in the neck characteristically moves upward with which action? Option A. Swallowing only. Option B. Protrusion of tongue. Option C. Neck flexion. Option D. Deep breathing. The correct answer is option B. Protrusion of tongue. Let's go through the options. Swallowing only. It moves with swallowing too, but the specific sign is tongue protrusion. Neck flexion. Neck flexion is not the sign. Deep breathing. Deep breathing is not the sign. And the correct answer is protrusion of tongue. Correct, a thyroglossal cyst moves up on protruding the tongue. So, the right answer is option B. Protrusion of tongue. Question 28. Among all breast cancers, which histological type occurs most frequently? Option A. Invasive lobular carcinoma. Option B. Medullary carcinoma. Option C. Invasive ductal carcinoma. Option D. Mucinous carcinoma. The correct answer is option C. Invasive ductal carcinoma. Let's go through the options. Invasive lobular carcinoma. Invasive lobular carcinoma is less common. Medullary carcinoma. Medullary carcinoma is uncommon. Mucinous carcinoma. Mucinous carcinoma is uncommon. And the correct answer is invasive ductal carcinoma. Correct, invasive ductal carcinoma is the commonest breast cancer. So, the right answer is option C. Invasive ductal carcinoma. Question 29. A breastfeeding mother develops a painful red swelling in her breast with fever. Which organism usually causes breast abscess during lactation? Option A. Staphylococcus aureus. Option B. Streptococcus pyogenes. Option C. Escherichia coli. Option D. Candida albicans. The correct answer is option A. Staphylococcus aureus. Let's go through the options. Streptococcus pyogenes. Strep pyogenes is a less common cause. Escherichia coli. E. coli is not the usual organism. Candida albicans. Candida does not cause breast abscess. And the correct answer is Staphylococcus aureus. Correct, Staphylococcus aureus is the usual cause of lactational breast abscess. So, the right answer is option A. Staphylococcus aureus. Question 30. A 20-year-old girl has a firm, painless, freely mobile breast lump that slips away under the examining fingers. What is this so-called breast mouse? Option A. Breast cyst. Option B. Carcinoma. Option C. Fat necrosis. Option D. Fibroadenoma. The correct answer is option D. Fibroadenoma. Let's go through the options. Breast cyst. A cyst is not typically a freely mobile firm lump. Carcinoma. Carcinoma is fixed, not freely mobile. Fat necrosis. Fat necrosis follows trauma and can be fixed. And the correct answer is fibroadenoma. Correct. A firm, painless, freely mobile breast mass in a young woman is a fibroadenoma. So, the right answer is option D. Fibroadenoma. Question 31. Years after a caesarean section, a woman develops colicky abdominal pain with vomiting and distension. What is the most common cause of intestinal obstruction after previous surgery? Option A. Hernia. Option B. Adhesions. Option C. Tumor. Option D. Volvulus. The correct answer is option B. Adhesions. Let's go through the options. Hernia. A hernia is a cause but not the commonest post-surgical one. Tumor. A tumor is a less likely post-surgical cause. Volvulus. Volvulus is uncommon. And the correct answer is adhesions. Correct. Adhesions are the commonest cause of intestinal obstruction after previous surgery. So, the right answer is option B. Adhesions. Question 32. During pregnancy, the position of the appendix changes because the enlarging uterus pushes it. Option A. Downward. Option B. Backward only. Option C. Upward. Option D. It does not move. The correct answer is option C. Upward. Let's go through the options. Downward. The appendix is not pushed downward in pregnancy. Backward only. It is displaced up, not only backward. It does not move. It does move with the growing uterus. And the correct answer is upward. Correct. The enlarging uterus pushes the appendix upward in pregnancy. So, the right answer is option C. Upward. Question 33. If gallbladder surgery becomes unavoidable during pregnancy, which trimester is considered safest for operating? Option A. Second trimester. Option B. First trimester. Option C. Third trimester. Option D. Any trimester equally. The correct answer is option A. Second trimester. Let's go through the options. First trimester. The first trimester risks teratogenesis miscarriage. Third trimester. The third trimester risks preterm labor. Any trimester equally. The trimesters are not equally safe. And the correct answer is second trimester. Correct. The second trimester is safest for necessary surgery in pregnancy. So, the right answer is option A. Second trimester. Question 34. An elderly woman has a scaly eczema-like sore on her nipple that refuses to heal. Paget disease of the nipple points to an underlying. Option A. Fungal infection. Option B. Simple eczema. Option C. Benign papilloma. Option D. Ductal carcinoma of the breast. The correct answer is option D. Ductal carcinoma of the breast. Let's go through the options. Fungal infection. A non-healing nipple lesion is not fungal. Simple eczema. It is not simple eczema. Benign papilloma. It is not a benign papilloma. And the correct answer is ductal carcinoma of the breast. Correct. Paget disease of the nipple signifies an underlying ductal carcinoma. So, the right answer is option D. Ductal carcinoma of the breast. Question 35. While coughing, a tall thin young woman suddenly becomes severely short of breath within minutes. What has most likely happened? Option A. Pneumonia. Option B. Pneumothorax. Option C. Pleural effusion. Option D. Bronchiectasis. The correct answer is option B. Pneumothorax. Let's go through the options. Pneumonia. Pneumonia does not cause sudden minutes-long dyspnea on coughing. Pleural effusion. A pleural effusion develops gradually. Bronchiectasis. Bronchiectasis is chronic. And the correct answer is pneumothorax. Correct. A tall thin young person with sudden dyspnea has a spontaneous pneumothorax. So, the right answer is option B. Pneumothorax. Question 36. All of the following statements about classical dengue fever are correct except Option A. It is a self-limiting illness. Option B. It is called breakbone fever. Option C. Leg-raising test positive. Option D. Its case fatality rate is low. The correct answer is option C. Leg-raising test positive. Let's go through the options. It is a self-limiting illness. Dengue is self-limiting, true. It is called breakbone fever. It is called breakbone fever, true. Its case fatality rate is low. Classical dengue has a low case fatality rate, true. And the correct answer is leg-raising test positive. Correct, the statement is false. A positive leg-raising test is not a feature of dengue. So, the right answer is option C. Leg-raising test positive. Question 37. An elderly woman's pulse is irregularly irregular. Which is the most common sustained abnormality of heart rhythm? Option A. Atrial fibrillation. Option B. Ventricular tachycardia. Option C. Atrial flutter. Option D. Complete heart block. The correct answer is option A. Atrial fibrillation. Let's go through the options. Ventricular tachycardia. VT is regular and life-threatening. Atrial flutter. Atrial flutter is usually regular. Complete heart block. Complete heart block gives a slow regular pulse. And the correct answer is atrial fibrillation. Correct, an irregularly irregular pulse is atrial fibrillation, the commonest sustained arrhythmia. So, the right answer is option A. Atrial fibrillation. Question 38. Immediately after an injection of penicillin, a woman develops difficulty in breathing and her blood pressure falls. Which drug must be given first? Option A. Hydrocortisone. Option B. Chlorpheniramine. Option C. Salbutamol. Option D. Adrenaline. The correct answer is option D. Adrenaline. Let's go through the options. Hydrocortisone. Hydrocortisone is adjunctive, not first. Chlorpheniramine. Chlorpheniramine is adjunctive. Salbutamol. Salbutamol treats bronchospasm but is not first line for anaphylaxis. And the correct answer is adrenaline. Correct, adrenaline is the first drug in anaphylaxis. So, the right answer is option D. Adrenaline. Question 39. Which type of viral hepatitis is transmitted through contaminated food and water? Option A. Hepatitis B. Option B. Hepatitis A. Option C. Hepatitis C. Option D. Hepatitis D. The correct answer is option B, hepatitis A. Let's go through the options. Hepatitis B. Hepatitis B is blood-body fluid borne. Hepatitis C. Hepatitis C is blood-borne. Hepatitis D. Hepatitis D is blood-borne, needs HBV. And the correct answer is hepatitis A. Correct. Hepatitis A is transmitted via contaminated food and water, fecal-oral. So, the right answer is option B. Hepatitis A. Question 40. For a woman taking warfarin for atrial fibrillation, the international normalized ratio should usually be kept between option A 1 to 2, option B 2 to 3, option C 3 to 4, option D 4 to 5. The correct answer is option B 2 to 3. Let's go through the options. 1 to 2. An INR of 1 to 2 is subtherapeutic. 3 to 4. 3 to 4 is too high for AF. 4 to 5. 4 to 5 risks bleeding. And the correct answer is 2 to 3. Correct. For AF, warfarin is dosed to an INR of about 2 to 3. So, the right answer is option B. 2 to 3. Question 41. A woman who is not pregnant is brought in with continuous fits that are not stopping. Which drug should be given first? Option A, oral phenytoin. Option B, intravenous mannitol. Option C, intravenous benzodiazepine. Option D, oral valproate. The correct answer is option C, intravenous benzodiazepine. Let's go through the options. Oral phenytoin. Oral phenytoin is too slow for status. Intravenous mannitol. Mannitol is for raised ICP, not seizures. Oral valproate. Oral valproate is not the emergency first drug. And the correct answer is intravenous benzodiazepine. Correct. For benzodiazepine, e.g. lorgepam diazepam, is first line for status epilepticus. So, the right answer is option C. Intravenous benzodiazepine. Question 42. In Pakistan, which infection is the leading cause of cirrhosis of the liver? Option A, hepatitis C. Option B, alcohol. Option C, hepatitis A. Option D, Wilson disease. The correct answer is option A, hepatitis C. Let's go through the options. Alcohol. Alcohol is a less common cause here. Hepatitis A. Hepatitis A does not cause cirrhosis. Wilson disease. Wilson disease is rare. And the correct answer is hepatitis C. Correct. Hepatitis C is the leading cause of cirrhosis in Pakistan. So, the right answer is option A. Hepatitis C. Question 43. A drowsy young diabetic woman is breathing in a deep sighing pattern. Which condition produces this small breathing? Option A, respiratory alkalosis. Option B, opioid poisoning. Option C, anxiety. Option D, diabetic ketoacidosis. The correct answer is option D, diabetic ketoacidosis. Let's go through the options. Respiratory alkalosis. Respiratory alkalosis does not cause small breathing. Opioid poisoning. Opioids cause slow shallow breathing. Anxiety. Anxiety causes rapid shallow breathing. And the correct answer is diabetic ketoacidosis. Correct. Deep sighing, Small, breathing in a drowsy diabetic is diabetic ketoacidosis. So, the right answer is option D. Diabetic ketoacidosis. Question 44. Which anticoagulant crosses the placenta, causes birth defects, and must never be given during pregnancy? Option A. Paracetamol. Option B. Warfarin. Option C. Amoxicillin. Option D. Folic acid. The correct answer is option B. Warfarin. Let's go through the options. Paracetamol. Paracetamol is not an anticoagulant. Amoxicillin. Amoxicillin is safe in pregnancy. Folic acid. Folic acid is recommended in pregnancy. And the correct answer is warfarin. Correct, warfarin crosses the placenta and is teratogenic, never give in pregnancy. So, the right answer is option B. Warfarin. Question 45. Vomiting caused by cancer chemotherapy is mediated mainly through which receptor? Option A. Dopamine D2. Option B. Histamine H1. Option C. Serotonin 5-HT3. Option D. Muscarinic M1. The correct answer is option C. Serotonin 5-HT3. Let's go through the options. Dopamine D2. D2 blockade helps but 5-HT3 is the main chemotherapy pathway. Histamine H1. H1 is for motion sickness. Muscarinic M1. M1 is for motion secretions, not chemoemesis. And the correct answer is serotonin 5-HT3. Correct, chemotherapy-induced vomiting is mainly 5-HT3 mediated, hence ondansetron. So, the right answer is option C. Serotonin 5-HT3. Question 46. A woman with bipolar disorder takes a mood stabilizer whose blood level must be checked regularly because its safe range is very narrow. Which drug is this? Option A. Lithium. Option B. Paracetamol. Option C. Amoxicillin. Option D. Omeprazole. The correct answer is option A. Lithium. Let's go through the options. Paracetamol. Paracetamol is not a mood stabilizer. Amoxicillin. Amoxicillin is an antibiotic. Omeprazole. Omeprazole is a PPI. And the correct answer is lithium. Correct, lithium is a mood stabilizer with a narrow therapeutic range needing level monitoring. So, the right answer is option A. Lithium. Question 47. Misna is administered alongside cyclophosphamide in order to prevent. Option A. Bone marrow suppression. Option B. Alopecia. Option C. Cardiotoxicity. Option D. Hemorrhagic cystitis. The correct answer is option D. Hemorrhagic cystitis. Let's go through the options. Bone marrow suppression. Misna does not prevent marrow suppression. Alopecia. It does not prevent alopecia. Cardiotoxicity. It does not prevent cardiotoxicity. And the correct answer is hemorrhagic cystitis. Correct, Misna prevents cyclophosphamide-induced hemorrhagic cystitis. So, the right answer is option D. Hemorrhagic cystitis. Question 48. Muscle pain and weakness developing in a woman taking atorvastatin represent which characteristic adverse effect? Option A. Nephropathy. Option B. Myopathy. Option C. Ototoxicity. Option D. Retinopathy. The correct answer is option B, myopathy. Let's go through the options. Nephropathy. Statins do not classically cause nephropathy. Ototoxicity. They are not ototoxic. Retinopathy. They do not cause retinopathy. And the correct answer is myopathy. Correct. Statins cause myopathy, muscle pain, weakness, raised CK. So, the right answer is option B. Myopathy. Question 49. For the burning pain of diabetic neuropathy, which antiepileptic drug is preferred? Option A, carbamazepine. Option B, valproate. Option C, gabapentin. Option D, phenobarbital. The correct answer is option C, gabapentin. Let's go through the options. Carbamazepine. Carbamazepine is preferred for trigeminal neuralgia. Valproate. Valproate is not first line for diabetic neuropathy. Phenobarbital. Phenobarbital is not used for this. And the correct answer is gabapentin. Correct. Gabapentin or pregabalin is preferred for diabetic neuropathic pain. So, the right answer is option C. Gabapentin. Question 50. In a woman losing blood through heavy periods, which laboratory value falls first as the body's iron stores become depleted? Option A, decreased serum ferritin. Option B, low hemoglobin. Option C, microcytosis. Option D, low serum iron. The correct answer is option A, decreased serum ferritin. Let's go through the options. Low hemoglobin. Hemoglobin falls later. Microcytosis. Microcytosis appears later. Low serum iron. Serum iron falls after ferritin. And the correct answer is decreased serum ferritin. Correct. Serum ferritin, iron stores, falls first in developing iron deficiency. So, the right answer is option A. Decreased serum ferritin. Question 51. A pregnant woman's microcytic anemia fails to improve with iron therapy and her blood film shows target cells. Which condition should be suspected? Option A, iron deficiency anemia. Option B, megaloblastic anemia. Option C, aplastic anemia. Option D, thalassemia. The correct answer is option D, thalassemia. Let's go through the options. Iron deficiency anemia. Iron deficiency would respond to iron. Megaloblastic anemia. Megaloblastic anemia is macrocytic, not microcytic with target cells. Aplastic anemia. Aplastic anemia is not microcytic with target cells. And the correct answer is thalassemia. Correct. Microcytic anemia unresponsive to iron with target cells suggests thalassemia. So, the right answer is option D. Thalassemia. Question 52. Massive enlargement of the spleen with a very high total leukocyte count and the Philadelphia chromosome establishes which diagnosis? Option A, acute lymphoblastic leukemia. Option B, chronic myeloid leukemia. Option C, Hodgkin lymphoma. Option D, multiple myeloma. The correct answer is option B, chronic myeloid leukemia. Let's go through the options. Acute lymphoblastic leukemia. All lacks the Philadelphia chromosome as a defining feature. Hodgkin lymphoma. Hodgkin lymphoma does not give this blood picture. Multiple myeloma. Myeloma does not cause this leukocytosis. And the correct answer is chronic myeloid leukemia. Correct: massive splenomegaly, very high WCC, and the Philadelphia chromosome indicate chronic myeloid leukemia. So, the right answer is option B. Chronic myeloid leukemia. Question 53. An elderly woman has bone pain, punched out lesions in the skull, and Benz-Jones proteins in her urine. What is the diagnosis? Option A. Nephrotic syndrome. Option B. Glomerulonephritis. Option C. Multiple myeloma. Option D. Diabetes. The correct answer is option C. Multiple myeloma. Let's go through the options. Nephrotic syndrome. Nephrotic syndrome does not cause punched-out skull lesions. Glomerulonephritis. Glomerulonephritis does not cause Benz-Jones proteins. Diabetes. Diabetes does not cause these. And the correct answer is multiple myeloma. Correct: bone pain, punched-out skull lesions, and Benz-Jones proteinuria indicate multiple myeloma. So, the right answer is option C. Multiple myeloma. Question 54. Which leukemia occurs most commonly in children? Option A. Acute lymphoblastic leukemia. Option B. Acute myeloid leukemia. Option C. Chronic myeloid leukemia. Option D. Chronic lymphocytic leukemia. The correct answer is option A. Acute lymphoblastic leukemia. Let's go through the options. Acute myeloid leukemia. AML is commoner in adults. Chronic myeloid leukemia. CML is an adult disease. Chronic lymphocytic leukemia. CLL is an elderly disease. And the correct answer is acute lymphoblastic leukemia. Correct: acute lymphoblastic leukemia is the commonest childhood leukemia. So, the right answer is option A. Acute lymphoblastic leukemia. Question 55. Worldwide, which organism causes most cases of watery diarrhea in infants and young children? Option A. Escherichia coli. Option B. Shigella. Option C. Giardia. Option D. Rotavirus. The correct answer is option D. Rotavirus. Let's go through the options. Escherichia coli. E. coli causes some diarrhea, but not most infant watery diarrhea worldwide. Shigella. Shigella causes dysentery. Giardia. Giardia causes chronic diarrhea. And the correct answer is rotavirus. Correct: rotavirus causes most watery diarrhea in infants and young children. So, the right answer is option D. Rotavirus. Question 56. For how long should a baby receive breast milk alone, without any other food or even water? Option A. 3 months. Option B. 6 months. Option C. 9 months. Option D. 12 months. The correct answer is option B. 6 months. Let's go through the options. 3 months. 3 months is too short for exclusive breastfeeding. 9 months. 9 months is too long for exclusive feeding. 12 months. 12 months is too long. And the correct answer is 6 months. Correct: exclusive breastfeeding, no water food, is recommended for the first 6 months. So, the right answer is option B. 6 months. Question 57. After conducting a delivery, at which 2 time points is the Apgar score of the newborn recorded? Option A. At birth only. Option B. 1 and 5 minutes. Option C, 10 and 20 minutes. Option D, 1 hour and 24 hours. The correct answer is option B, 1 and 5 minutes. Let's go through the options. At birth only. Upgar is not recorded at birth only. 10 and 20 minutes. 10 and 20 minutes is not standard. Extended scores only if low. 1 hour and 24 hours. 1 hour and 24 hours is not the Upgar timing. And the correct answer is 1 and 5 minutes. Correct, the Upgar score is recorded at 1 and 5 minutes after birth. So, the right answer is option B. 1 and 5 minutes. Question 58. According to Pakistan's expanded program on immunization, the first dose of measles vaccine is given at what age? Option A, 6 weeks. Option B, 6 months. Option C, 9 months. Option D, 15 months. The correct answer is option C, 9 months. Let's go through the options. 6 weeks. 6 weeks is for the first pentavalent OPV doses. 6 months. 6 months is not the AP measles time. 15 months. 15 months is the second dose in some schedules. And the correct answer is 9 months. Correct, in Pakistan's AP the first measles dose is given at 9 months. So, the right answer is option C. 9 months. Question 59. Which eye disease is responsible for the largest number of blind people in Pakistan? Option A, glaucoma. Option B, trachoma. Option C, cataract. Option D, diabetic retinopathy. The correct answer is option C, cataract. Let's go through the options. Glaucoma. Glaucoma is a major but not the largest cause of blindness here. Trachoma. Trachoma is less common now. Diabetic retinopathy. Diabetic retinopathy is a growing but smaller cause. And the correct answer is cataract. Correct, cataract is the leading cause of blindness in Pakistan. So, the right answer is option C. Cataract. Question 60. A pregnant woman complains that she cannot see anything after sunset. Deficiency of which vitamin causes night blindness? Option A, vitamin A. Option B, vitamin B12. Option C, vitamin C. Option D, vitamin D. The correct answer is option A, vitamin A. Let's go through the options. Vitamin B12. B12 deficiency causes anemia neuropathy. Vitamin C. Vitamin C deficiency causes scurvy. Vitamin D. Vitamin D deficiency causes rickets osteomalacia. And the correct answer is vitamin A. Correct, vitamin A deficiency causes night blindness, nyctalopia. So, the right answer is option A. Vitamin A. Question 61. What is the normal range of pressure inside the eye? Option A, 2 to 8 mm of mercury. Option B, 10 to 21 mm of mercury. Option C, 25 to 35 mm of mercury. Option D, 40 to 50 mm of mercury. The correct answer is option B, 10 to 21 mm of mercury. Let's go through the options. 2 to 8 mm of mercury. 2 to 8 mm of mercury is too low. 25 to 35 millimeters of mercury. 25 to 35 millimeters of mercury indicates glaucoma. 40 to 50 millimeters of mercury. 40 to 50 millimeters of mercury is markedly raised. And the correct answer is 10 to 21 millimeters of mercury. Correct normal intraocular pressure is about 10 to 21 millimeters of mercury. So, the right answer is option B. 10 to 21 millimeters of mercury. Question 62. Swelling of both optic discs found in an obese young woman with constant headaches indicates. Option A. Glaucoma. Option B. Optic neuritis. Option C. Retinal detachment. Option D. Raised intracranial pressure. The correct answer is option D. Raised intracranial pressure. Let's go through the options. Glaucoma. Glaucoma gives cupping, not bilateral disc swelling. Optic neuritis. Optic neuritis is usually unilateral. Retinal detachment. Retinal detachment does not swell both discs. And the correct answer is raised intracranial pressure. Correct bilateral disc swelling, papilloedema, in an obese young woman with headaches indicates raised intracranial pressure, E. So, the right answer is option D. Raised intracranial pressure. Question 63. Before planning pregnancy, a woman asks about vaccination. Which vaccine must never be given during pregnancy because it contains live virus? Option A. Tetanus toxoid. Option B. Rubella. Option C. Hepatitis B. Option D. Influenza. The correct answer is option B. Rubella. Let's go through the options. Tetanus toxoid. Tetanus toxoid is recommended in pregnancy. Hepatitis B. Hepatitis B vaccine is safe in pregnancy. Influenza. Influenza, inactivated, is recommended in pregnancy. And the correct answer is rubella. Correct, rubella is a live vaccine and is contraindicated in pregnancy. So, the right answer is option B. Rubella. Question 64. Isolation of the patient is unnecessary in which of the following diseases because it does not spread from person to person? Option A. Measles. Option B. Chickenpox. Option C. Tetanus. Option D. Open tuberculosis. The correct answer is option C. Tetanus. Let's go through the options. Measles. Measles is highly contagious and needs isolation. Chickenpox. Chickenpox is contagious. Open tuberculosis. Open TB is contagious and needs isolation. And the correct answer is tetanus. Correct, tetanus does not spread person to person, so isolation is unnecessary. So, the right answer is option C. Tetanus. Question 65. In a double-blind trial of a new medicine, who remains unaware of which treatment is being given? Option A. Both patient and doctor are unaware of treatment. Option B. Only the patient is unaware. Option C. Only the doctor is unaware. Option D. Only the statistician is unaware. The correct answer is option A. Both patient and doctor are unaware of treatment. Let's go through the options. Only the patient is unaware. Only the patient blinded is single blind. Only the doctor is unaware. Only the doctor blinded is not double blind. Only the statistician is unaware. Blinding the statistician alone is not double-blind. And the correct answer is both patient and doctor are unaware of treatment. Correct. In a double-blind trial, neither the patient nor the doctor knows the treatment. So, the right answer is option A. Both patient and doctor are unaware of treatment. Question 66. Which single cause kills the largest number of mothers during and after childbirth? Option A. Sepsis. Option B. Eclampsia. Option C. Obstructed labor. Option D. Hemorrhage. The correct answer is option D. Hemorrhage. Let's go through the options. Sepsis. Sepsis is a major but not the leading cause. Eclampsia. Eclampsia is a major cause but second to hemorrhage. Obstructed labor. Obstructed labor contributes but hemorrhage kills most. And the correct answer is hemorrhage. Correct. Hemorrhage is the leading cause of maternal death. So, the right answer is option D. Hemorrhage. Question 67. Nose bleeding most often starts from which part of the nose? Option A. Posterior nasal cavity. Option B. Little's area. Option C. Nasopharynx. Option D. Middle turbinate. The correct answer is option B. Little's area. Let's go through the options. Posterior nasal cavity. Posterior bleeds are less common and more severe. Nasopharynx. The nasopharynx is not the usual source. Middle turbinate. The middle turbinate is not the classic site. And the correct answer is Little's area. Correct. Most epistaxis arises from Little's area, Kisselbach plexus, on the anterior septum. So, the right answer is option B. Little's area. Question 68. When a tuning fork is heard better through the bone than through the air, giving a negative RINA test, what type of hearing loss is present? Option A. Sensorineural hearing loss. Option B. Normal hearing. Option C. Conductive hearing loss. Option D. Central deafness. The correct answer is option C. Conductive hearing loss. Let's go through the options. Sensorineural hearing loss. In sensorineural loss, both air and bone conduction fall, RINA positive. Normal hearing. Normal hearing gives a positive RINA. Central deafness. Central deafness does not give this pattern. And the correct answer is conductive hearing loss. Correct. Bone conduction better than air, negative RINA, indicates conductive hearing loss. So, the right answer is option C. Conductive hearing loss. Question 69. Which bacterium is the usual cause of acute follicular tonsillitis in children? Option A. Group A Streptococcus. Option B. Staphylococcus aureus. Option C. Haemophilus influenzae. Option D. Candida. The correct answer is option A. Group A Streptococcus. Let's go through the options. Staphylococcus aureus. Staph aureus is a less common cause. Haemophilus influenzae. H. influenzae is not the classic tonsillitis organism. Candida. Candida causes thrush, not follicular tonsillitis. And the correct answer is Group A Streptococcus. Correct. Group A Streptococcus is the usual cause of acute follicular tonsillitis. So, the right answer is option A. Group A Streptococcus. Question 70. A peanut inhaled by a toddler most often lodges in which part of the airway? Option A, left main bronchus. Option B, trachea. Option C, larynx. Option D, right main bronchus. The correct answer is option D, right main bronchus. Let's go through the options. Left main bronchus. The left main bronchus is less commonly involved. Trachea. The trachea is not the usual lodging site. Larynx. The larynx would cause acute choking, not typical lodging. And the correct answer is right main bronchus. Correct. An inhaled foreign body most often lodges in the wider, more vertical right main bronchus. So, the right answer is option D. Right main bronchus.